What are your thoughts on Prostate Peddlers as a group, a charity, the sport involved, and the way forward? Is it something that you feel would be helpful to patients who have prostate cancer?
Yeah, absolutely. I mean, first of all, it's a really enjoyable day, so I've enjoyed myself a lot. But actually, for the well-being of patients, I would certainly recommend it. We know that exercise will help prevent you getting prostate cancer in the first place, but of course most of your members would have already had it. But even if you've had it, there are a number of benefits, including being able to tolerate hormone therapies, faster recovery from surgery or radiotherapy. And even if you've gone into complete remission, you think your disease is probably gone, it will reduce the chance of your disease coming back somewhat. So, it's an all-win situation. It'll make you feel better, reduce the toxicities, and improve your outcomes.
Should anyone be careful if they're in the middle of chemotherapy treatment, for example, having just had surgery, or do we wait for professionals, or do men wait for professionals to tell them when it's safe to cycle again? Do you see that?
Well, the problem with, asking your doctor, that you see that on site and information sheets, but to be honest, most doctors really don't understand the data about exercise. I mean, the big drive, of course, is prehabilitation, to exercise before your surgery or radiotherapy. A trial we've done in Cambridge showed that if you exercise during your radiotherapy, you have less of a chance of erectile dysfunction and pelvic disorders. But not a lot of doctors actually know that, so they will say to the patients, take it easy, and it's not actually correct advice. I always refer to a study called the PACES study, which looked at people randomized to intense exercise or not during chemotherapy. And the intense group did so much better. They had better immunities, recovered quicker. Yet patients are still being told to take it easy during chemotherapy. So you won't always get the best advice. And what Prostate Peddlers have done is just gone on and done it. They provide a facility, a safe facility for patients to exercise together. And there's a couple of small caveats in the long term, like osteoporosis. We want patients who've had hormone therapy, for example, to do some weight-bearing exercise. But a combination of both, so cycling most of the time to get your heart and lungs fitter, but combine that with a little bit of squats or resistance training as well would be a good idea. And of course, safety, it's good that you're in a group, and Prostate Peddlers are mainly off-road, so it's quite a safe pastime, and it's something which is enjoyable. At the end of the day, if it's not enjoyable, people aren't going to come back and do it.
And do you find that there's more adherence to activity when it is in a group like this, rather than people exercising maybe at home on a static bike?
Yes, it's absolutely right. In terms of psychological well-being, you get support of other cyclists. And we know that being in a better mood, for example, does reduce some of the biological markers, such as chronic inflammation, which have a direct benefit on its own. So notwithstanding just the benefits of the exercise, the group activity adds an extra plus. And it adds a bit of safety as well, because people are looking out for each other. And we know that group exercise, people are more likely to adhere to them in the long term and come back. Whereas, if you're at home, you've always got an excuse to do something else. And also being outdoors, looking at the blue sky will help your sleep, help your circadian rhythm, get some vitamin D, all of which add to the benefit of it.
Another benefit of the exercise is people start to look at their weight loss, gaining muscle. And do you think because of that possibly they change their diets and start to live an altogether more healthy lifestyle?
Yes, I mean, exercise could be a catalyst to generally improving your health, especially if you're in a nice environment like the cafe today, where they offer healthy food. So, people will maybe have a bit of competition between each other. I can do a little bit better next week. I mean, Weight Watchers, that's how Weight Watchers work, is they sort of put people on the spot, and it's a similar sort of thing in an informal way. But that said, although it's good to lose weight, actually, if you are overweight and you're exercising, even if you're not losing the pounds, it's still significantly good for you, because you increase muscle mass, and it's the loss of muscle mass with, say, the hormones or inactivity is the problem. So even if you're not losing weight, if you're increasing your muscle mass, you're doing yourself enormous benefit. Well, it's been a really enjoyable day for myself. I can see it amongst the people who've also attended, and I would certainly recommend Prostate Peddlers to the patients I see, as well as the staff I work with, the support nurses and my oncologist. They'll all benefit from it.